2030 that is entitled Including Persons with Disabilities in Local Disaster Resilience Planning. My name is Martha Mugarura. I'm here in Kampala City, Uganda. I work as Assistant Commissioner Urban Development, and I'm an urban planner myself. I have practiced in urban planning for the last 15 years. It is my pleasure today to moderate today's session, which has drawn such a global audience from all of us who are in policy, who are practicing and interested in this important issue of how we can scale up the engagement of inclusion of persons with disabilities in local resilience planning and action. Today, our webinar will be in English, and we shall also have simultaneous interpretations in Spanish and international sign language. Thank you very much. As you all know, 1 billion people around the world live with some form of disability. It might be physical or otherwise. And in times of disaster, this number is disproportionately affected and suffers as a result of disasters surrounding them. Some of them end up dying, and some of them do suffer consequences after the disaster. So therefore, local disaster prevention measures are regularly designed and implemented, however, without the inclusion of persons with disabilities. And this is the concern we have today. And rarely in these do we take into account their unique perspectives and contributions to the communities that are affected the most during disasters. We also know that the Sendai framework for disaster reduction makes a case for an inclusive, accessible, all for society approach to protect lives, livelihoods, and the well-being of those who are most affected during times of disaster and in cities like the ones that we live in. Therefore, persons living with disabilities represent 1/5 of the world's population and need to be included in the plans and actions to reduce disaster risk and therefore benefit their communities and cities as a whole. Allow me now, in today's webinar, to introduce the subject that we are going to discuss, the scorecard, the scorecard for inclusion of persons with disabilities. This has been annexed to the Making Cities Resilient Scorecard, as you very well know. And it's now available online on the Making Cities Resilient network. I therefore now would like to call upon other members in this audience to contribute to this discussion and to hear from them their perspectives on how this scorecard can be applied in cities. I would like to now call upon Mr. Carlos Kaiser, the Director of ONG Inclusiva in Chile, who has been the overall architect of the development of the Annex to the Scorecard for the inclusion of persons with disabilities. Mr. Carlos, you're most welcome.
Thanks, yes. Many thanks for this very interesting presentation you gave us. It's a great honor to me to be here talking to all of you. Also, I have to say that I was waiting for this day with a lot of energy and passion because it's a very important process, this scorecard for the inclusion of persons with disabilities into resilient cities. So I will start saying many things. First, as many people know, I'm a person living with disabilities myself. I have incomplete limbs, upper and lower limbs. And I live in this situation my whole life. So that's why I'm advocating for a world that is inclusive for everyone. And I specialize myself into disaster risk reduction. So working from Inclusiva, that is an NGO that we are having this great alliance with UNDRR, that we have been working in several parts of the world, starting in Latin America and the Caribbean. With the network we are one of the founder members of the network for disaster risk reduction that we have in Latin America and the Caribbean. Also, we are helping to create the network in Africa for disaster risk reduction and disabilities. And the experiences we have with different platforms all over the world, I reached to the conclusion several years ago that we need to work with the local governments. We, as Inclusiva, won the Risk Award for 2014 and with a project in Peñaflor. Peñaflor is a town in Chile. I live in Peñaflor. As a matter of fact, I'm broadcasting now from Peñaflor town. And we won this award, and we create a model for disaster risk reduction, working with the local governments. So the thing is that we strongly believe that we needed to advance in this. So I start conversation with UNDRR, talking about resilient cities, and saying that resilient cities need to focus also on disabilities, on the inclusion of people with disabilities. But it couldn't be just because of the need of doing this. It got to be with science, with knowledge, with the best of methodologies applied into this effort. So in 2019, I had the opportunity to talk with Mr. Raúl Salazar. Raúl Salazar, as you know, is the director of UNDRR for the Americas and the Caribbean. He's a great leader also, and I have to tell that Raúl not only helped us to work on this, he encouraged it. So I told to him that I talked with Raúl and said, Raúl, we really need to advance on this. I had also a conversation with Stephanie Dannenman. She is working also in UNDRR. She is in charge of disabilities, and great person that is a great collaborator of inclusion. She really advocates for inclusion of people with disabilities in disaster risk reduction. I work with a different person like, for instance, Jennifer Gularnik, and all the, well, I have to say sorry for all the people because it's a long, long list of people that we were talking about this, working on this. So in 2020, I was hired to produce the very first draft of the scorecard of inclusion of people with disabilities. It was very challenging because, you know, the scorecard is a system that they have with the 10 essentials of the campaign that you need to address and have to be useful enough for local governments to apply and to get results. They need results. I used to be an official of a local government in Chile myself, so I know how to work in a local government. So what we needed at the time was to create something that was simple for being easy to use, but at the same time with the complexity of answering all the needs that were in front of us. Statistical data, meaningful participation of people with disabilities, also the knowledge that the local governments would present about the situation of the people living with disabilities into their own cities. All those things were taken into account to develop this. Why I started this? Because not only was my dream to work with this, because I know that is the future. As this campaign of resilient cities, they know that if you got all the local governments, finally you get the right answer and preparedness for disasters. I said that because of Sendai and because of the Convention of People with Disabilities, our rights that are in this convention, we cannot avoid to make these things inclusive. Because as you know, Sendai framework said that it must be inclusive.
Yeah.
And if we all agreed on Sendai framework, we have to apply Sendai framework. We have to enforce it, not only discuss about it. We have to make something real. We have to do things that work for everyone. So what I'm just about to finish, I want to say that we are working from Inclusiva with ASB. ASB is the Arbeiter-Samariter-Bund from Germany. We are also working with Sepredenac from Central America. We are working with CDD from Bangladesh. We are having support from our friends from Munich Re Foundation. And we are working with some help promotion from World Bank to establish a network promoting disability inclusive resilient cities. So we are looking for all the partnerships needed. We are going to have a conversation with UNDRR if we can work together on this, because we really want to support and to also go forward on this, working with the local governments. We know that it's feasible, it's possible, something we desire. We get the people, we get the right person working on it, several institutions. So we are making a very powerful coalition to bring this to the table, to make this happen. So I want to say all of your support from this. I have to say thanks UNDRR for making this possible. I have to say to all the mayors in the world that help us and use this new scorecard. And I want to probably in 1 year after this, we can discuss it as the successful of this scorecard. So thanks.
Thank you, Carlos. Without you being real in this process, we probably wouldn't have come to this. So thank you for your action. Thank you for your input. I'd like to now invite Mr. Zadko, the head of the Department of Civil Protection Affairs in the city of Kajevo in Serbia, to give us an overview of how he has come this far with this discussion we have today. Thank you.
Thank you, Marta, and thank you, UNDRR, for this great opportunity to present our work. And at first, I just want to point out that it's very difficult and hard for me after Carlos to say something on this topic, but okay, I'm going to try just to say a few words about our work. And it's not just work in the city of Kraljevo, but actually it's work of 18 local municipalities in West Morava River Basin. That is something that we established after floods 2014 here in Serbia. Actually, I have written right down my speech today, and if you don't mind, I'm going to just read this 30 sentence of my speech, because I'm not really good in English, and maybe I don't feel comfortable enough to just express myself and our work in common language. Yes.
Thank you. You're welcome to do so.
Thank you, Marta. First about experience. Okay, my city hit a big earthquake 2010. After that, we had floods 2014 and 2016, as well as every year snow drifts, forest fires, and landslides. Suddenly, we began to pay a bill for climate change and for the lack of investment in prevention. Hundreds of houses were destroyed in the earthquake and floods also local businesses and agricultural areas. We had destroyed bridges and roads, and everything that led to the need to take a more active approach to disaster risk reduction process. I'm going to call this process civil protection system. However, the most sensitive categories of population, people with disabilities, remained mute in the time when disasters were occurring. At certain times, the system was blind to the needs of this part of our population. It was mostly the institutions dealing with social protection issues immediately after disasters that provide support. But these categories of the population just need more. What did we do? Actually, we have two dimensions of inclusive disaster risk management in our work. It is normative framework and institutional framework. Actually, that's very connected parts of our work and whole system. And the very beginning of the pandemic in Serbia, March 2020, indicated the need for a more mobile role of the civil protection system. Thanks to the cooperation with the municipality of Rakchar and actually towards the establishment of intermunicipal cooperation in West Morava River Basin, we have developed special instructions for the blind, deaf people with reduced mobility and the sick. You can see something of that. Maybe here is for the blinds on Braille alphabets, okay. And it's something that we just have as a new practice is in our work. Actually, our local documents like risk assessments, protection and rescue plans, and other instructions contain as a focus topics of importance to persons with disabilities. Representatives of association of persons with disabilities are members of work teams, expert commissions, and commissions for assessment of damages and needs after disaster. It's called post-disaster needs assessment, you know. The active participation of these representatives contributes to the visibility of the needs and possibilities of persons with disabilities before, during, and after disasters. Prevention and early warning action in the system are especially important. The availability of warnings is crucial for proper action immediately before, during, and immediately after disasters. We include all these topics or questions in our planning documents. Actually, we just have turned around, you know, everything we have done till 2020, and our focus is actually on people with disabilities. Our plans are not based on those categories that will manage to overcome some obstacle, but the opposite. We have included the principle. It is actually something new in practice, in DRR practice. Even one stair can be obstacle or barrier in the process of creating our local politics or local strategies or local documents. All documents are publicly available for people with disabilities and for other local governments. We have included persons with disabilities or their representatives in the network of commissioners and deputy commissioners of civil protection. Through the preparation and organization of civil protection exercises, we came up with solutions for possible procedures in case before, during, and after disasters. And for the conclusion, I think that, and Carlos just point out that the key to the solution lies in partnerships, you know, and the first dimension of partnership refers to the partnership of the management of civil protection system with associations of persons with disabilities. Second dimension of the partnership refers to intermunicipal cooperation and cooperation with international and other organizations with knowledge and good practice. This partnership is based above all on the exchange of experience and examples of good and bad practice.
Okay.
And thirdly, the most important partnership is the one established in society among relatives, among friends, and among neighbors. Connection that they create with special care and that in moment of disaster represent a life vest and a safe place. All partnerships must be strategic, but also institutional to minimize the impact of disasters. In the end, we must not forget that every disaster is just a step further into poverty, and it's up to us to fight this courage in our local communities. And that's all from me today. Thank you very much.
Thank you, Drafco. That was very brilliant. The intention and purpose for disaster risk resilience and also inclusion of persons with disabilities is very clear in what you're doing in the city. I now would like to invite my third speaker today, Ms. Stephanie Jimenez, from the Reliance Actions and Policies Coordinator of the City of Mexico. Welcome, Stephanie. I would like to ask you to please give us an overview of the approach to disaster resilience in your city and the experience that you have shared on how inclusion not only addresses vulnerability, but opens up opportunities for resource-constrained local government. Welcome, Stephanie.
Thank you, Marta. And as Radko has already mentioned, it is very hard to follow up this conversation once we have Carlos with us. And I have been following the work of Carlos since many years ago, which is very interesting because it is important and to point out how we do not let discussions, critical discussions, out of important context and decision-making roundtables. So with this further ado, I'd like to thank you for having us as our Resilience Hub of MCR2030, because we see relevance of how we can present that there are different paths and initiatives that we can take to have further steps in the resilience roadmap of the initiative. So having this open dialogue for across latitudes, for us, it seems and it encourages to look for new collaboration routes to provide guidance so that different sectors and actors can play an active role. So it's not about having the say of leaving no one behind, but it's about having a meaningful participation, as Carlos was mentioning, an effective participation one, so that people with disabilities can be understood by us from the systemic and institutional way, that we have a responsibility to transform cities that are accessible and welcoming, and that cities are made for everyone, especially for people with disabilities. So from my perspective, I have very little experience on this. I was advocating many years ago for having the construction of hospitals for visual impairment people. So it is important because it seems that only with political will, there can be a very good incentive for doing things. But I think that this is where the annex of inclusion of people with disabilities comes to an important value for everyone, just to see where we are starting from and we're heading to. So for us, in this sector, I think that it is not a simple conversation, because we see on a daily basis on what's the cost of not having a proper development, and the one that it was based on an unequal system, and what's has been inherited to us. So for us, talking about how to deal with exclusion, how to deal with these barriers that people have faced due to a disability condition, it's more about having to think about what we should do to be able to do, we should be able to do so the city and the municipality is safer and dignified for you. So these conversations are not simple, because we have seen that there are conditions that we have not considered before. I mean, from the local perspective, it is very important just to have even data disaggregated, to have coordination among different sectors. And when we look beyond having we're encouraged to have a participatory mechanism, it becomes more complex because of the planning. It becomes more complex because sometimes you're demanded to have a result. But participation demands time. Participation demands processes that are accountable and that are adapted to people's context and how we live. So it becomes more complex, but we need to look at this intersectionality perspective so we can learn to know which are the concerns, where are the barriers about participation processes. And this is where our aspirations and the realistic context can cross paths. And in our city, Mexico City, we have to think about it for almost 18% of the population that have a disability, and not only for people with disabilities, but also with their families, because the impact also goes there. And something that we also have to recognize is that in the annex that is already available for everyone, is that it considers analyzing how the environmental barriers can affect and must be addressed to have more access and participation, either just for the community level, but also on the city level. And this is where I think that Carlos was mentioning about how we can make meaningful participation from our institutional approach actions. And this is not only for civil protection areas. This is important to be considered in different sectors, in schools, health centers, mobility systems, and even with the workforce to have a proper income, or yes, economic support, but it depends on the environments. It depends on which are the conditions of each person. So in order for us to know how to help to stop this exclusion, how to avoid deterring these vulnerabilities, we also have to look, okay, so where's the safety net? Where can we consider this in a multi-hazard context, or how do we maintain this when we don't have enough resources? Because yes, there are never enough resources, but if we see it more with the most unequal region in the world. So for us in Mexico City, we do know that we have different instruments. We have the civil comprehensive risk management and civil protection law, where it is recognized to have brackets, to have norms and technicalities to protect for people with disabilities. We also have special trainings, a practical guide, so we can recognize as institutions and public officers that there's a responsibility to have different dialogue spaces and have different channels of communication and platforms for different types of disabilities, these are simple elements that are mentioned here in the annex that is presented. And in another hand, on another way, we also have the resilience strategy that mentions the importance of improving the mobility system under a metropolitan approach that includes people with disabilities. However, this is where we have to be also critical about how institutions do go on the same way on the same speed, as cities and citizens' perspective and dynamics. Because while we have this on paper, we must look for this for the other side of that. For example, at the resilience strategy, there was a lack of recognition to verify the spaces, to verify the agency of people with disabilities and the mechanisms where we can follow up the initiatives or that could be presented. So it was only stated to have as a vulnerable groups perspective, which is totally contrary for having an agency to having your rights guaranteed. And while this institutional base and normal frame and the regulatory framework is important, for us and like halfway to Sendai, we must consider what's missing, where are we heading to. And so this technical approach is important to be escalated into ways of thinking, how we can approach different sectors, how can we make that urban design is considering an inclusion perspective. And for that, in the City of Mexico, through the resilience the general direction, which is the area I work for in the city, is that first, we have initiated a set of data that is available for civil protection officers so that we can start to interact and to acknowledge how is our population composed, where are the different dynamics to affecting each of the 16 municipalities that work here. And it may seem not tangible, but this is important to start by analyzing and raising awareness among decision makers that focus and work on disaster risk reduction across the whole process. In addition, we are working on an initiative to work with civil society organizations. And unfortunately, we do not have many participation of people with disabilities. We're just starting to create the database, but it is important because this is it is a focused, I wouldn't say red flag, but it's a red flag for us actually to take some action. And this is not to be pessimistic, but actually having the annex and having these initiatives and hearing, for example, Trafco's perspective and Carlos' approach, it gives us a baseline and also a route or where we have to head. How can we guide other decision makers to have a more inclusive and human-centered approach? And for that, this is our work is basically to set up the conditions on the local level so other stakeholders can participate. So we have to have these uncomfortable conversations just to evaluate if our areas have special attribution, but if they have budget, if they have influence to take action, if they have influence to have different planning activities. And this is where we are heading. For example, the evaluation of the resilience strategy. We're actually currently we're working on the update of the strategy, and we're focusing and inviting more actors, more stakeholders to have these the contributions, because this is one of the critical, making more social active and recognizing the human capital, the social capital linkage for having a more resilient city is very important for us. So I was asked also to mention, just to wrap up, I was asked to mention that there are different our partnerships, as Salcom was mentioning, are important, and we have to consider how we professionalize caregivers, blockchain initiatives to follow up needs on people with disabilities, especially in high-prone risk areas. And we just have to be brave enough to have the conversations so that these uncomfortable conversations of what we haven't been able to do, so a city is more safer and more proactive, so that everyone can be participating here. I think I'm on time, so yeah.
Thank you, Stephanie. Thank you for that. Actually, the three of you have given a very localized perspectives, and in this whole conversation, we have other participants who I believe would give us some or few remarks to what you have just shared with us. So I would like to now invite comments or questions to the three of my discussants here. I'm reading from some of the messages here. Is it possible for the presenters to share any publications, reports on the strategies for engaging people with disabilities? And this one is from Jackie. She's from Uganda, I know, but she's working in Nairobi right now. There's another one, I think, in Spanish, which I may not be able to read, but we shall be able to send an answer to that. There's another question here to the panelists. Do we have a template or standard to develop a training center on DRR for disability? I would like to start with Carlos. to respond to that last question, and probably on any publications and reports to share. But on this training center for DRL for disability, is it a practical solution? And then to my other speakers, just as we wrap up in a few seconds, Carlos, please.
Thanks, Martha. I would say that it's a great idea. Part of this we are making not as a center exactly, but some elements of it. For instance, now we are producing an international training course for the Americas, targeting local governments for they to learn how to be inclusive about disabilities and disaster risk reduction. And I believe that this center could be a very good idea in the sense that this thing can bring us to work together on promoting those things, like, for instance, the very same tool that we have created, this scorecard. Center, the only problem of center is that you have to locate it in a physical place, and then you have to be aware of how are you going to bring people from all over the world. That's the case that the Japanese International Corporation, they do this, JICA, you know, the TIC in Tokyo, and it's a model that could be replaced, but I mean, can be also, we can imitate this, but at the same time, it's expensive. The only part, the downhill of this is that it's expensive. So you have to pay to keep, to maintain the building, to pay all the workers there. And apart from this, you have to have the person that would work on the educational part of it. We are making this in a virtual way using now, you know, internet and so on. That's the way we're doing. But the main idea is that we need to focus on, how can they express, we have to focus on training people about disaster risk reduction and disabilities. And that's a great idea. So thanks for this question.
Before you leave us, Carlos, on that, could you please answer to this next question? In what time frame do you see the application of this scorecard? There's a question to you on the release of this disability annex, the scorecard. In what time frame do you think that we should see some results from it?
I want to see big impact in 1 year.
Oh,
a greater impact from the next 3 years. I'm very ambitious. And I have to say why, Martha, because you know that, as I told you, we already create a coalition of different institutions to promote this, and we aim and we are coordinating a meeting with UNDRR in order to broadly work together on the promotion of disability inclusive resilient cities, and that's to say to promote the scorecard, but not only the scorecard, to make a follow-up, to work with the local governments in order to ensure that they have all the skills or all the things they need in order to have this. I believe that it's not just making them to work this alone. Probably we are promoting to have this network, protecting, helping, promoting. And that's the way it's going to work. So if you ask me, first year, we are going to install it in different places. I have to say that, for instance, in Chile, we already have the Pudahuel city local government. They want to implement it. And in Colombia, we have a lot of people. In Mexico, we have a lot of people. We have different institutions that want to do this. We have the people, we have the will to do this. So we also need to apply for the funds, because you know that you need funding to money to do many things, but we can manage to get it. So that's my answer. We are going to be very ambitious on this. I would love to have this same conversation in 1 year and to say that is something that that we need to promote. And have to say thanks again to Stephanie Dannenman, to Raul Salazar, to Jennifer, and to all the team that make this possible. Thanks.
Thank you. Thank you for that ambition. May it go well. And to Zadrock, I would like to ask, from your experience, there is a question to you. What is the main advice that you give to local governments looking to scale up their efforts to include persons with disabilities? That was a question specifically to you.
Okay,
And
Marta.
your closing remarks.
Yes, just I want to say something about this center for education for DRM. Actually, we established one regional center for civil protection here in Serbia. It includes 18 municipalities in West Morava River Basin for trainings, and we have this kind of trainings with different associations, representatives of people with disabilities. It's very important to have these partnerships on that point or that level of your work, and actually we want to establish a resilience hub with MCR2030 for good examples in these 18 municipalities. It's going to call like 20 DRR things you need to see, and one of those things is going to be this Civil Protection Regional Center, and it's good opportunity maybe to share this kind of approach and this kind of practice with other communities worldwide. It's not just for Serbia, it's not just for this region of Europe, but worldwide. It's great opportunity maybe through UNDRR MCR2030 platform just to go step further. And for this question, how to engage local authorities or local self-government, it's very hard because I think maybe Carlos is going to just approve this. You need to have experience with all of this. It needs just to be like rock that you need to get out of your way, and because of that you need just to have this kind of experience with disasters, with people with disabilities. You need to have this kind of people in your local communities and in your administration, just to recognize this kind of approach and needs of those people, and not just needs. You need to have like this kind of perspective that you need to recognize their possibilities to act, in time before disaster or after disaster, and you need to include them in your system of local authorities. If they are out of system, every time it's going to be problem. They need to be a part of system. They need to be part of solutions. They need to be part of civil protection system. They need to be part of DRM, the disaster risk management in your city, or social, strategy. If they are not part of this process, it's going to be problem. Okay.
That's a good point. Thank you. Embedding others in the process during, after, and before, what I take from that. Stephanie, I would like to ask, there's a question to you here. I think you'll be able to read it yourself later. Who can I coordinate with to support the population with disabilities in Mexico? And that answer will be given by you, but please give me just in 2 sentences or half a minute, your parting shot, so that then we can wrap this up in time.
No worries. Thank you, Marta. Actually, we're just typing the mail where people can contact us. And yeah, I was actually looking, waiting if Carlos was also wanted to mention the focal point for Mexico, because there's taking into account other questions that were asked. For example, there was a very important program and virtual session of the ONG of Carlos about introduction of inclusive risk disaster risk assessment, and like in the beginning of last year, which was very important, and I had the opportunity to participate there through Goretti, which is a very nice partner here in Mexico. So that's why I was waiting on Carlos' response to this. But if people are willing to contact us for Mexico City, I think that the team is also very kind to share our mail. Please do not hesitate to contact us. We're just starting the consultations, and we're just learning as local governments. We want to go through there, but taking into consideration the annex, we're very happy to see where our discussions can lead us. Thank you, Marta.
Thank you very much to my three discussants here today. We had a very good insight from your own examples, from your own work. Carlos, you seem to be the man of praise today. Thank you very much for making this a reality. You asked for to be real, but it's real because we have the scorecard with us, and we pledge to utilize it, to put it to good use in our cities. Thank you, Zadok, for that insight that we need to bring in the support before we get into the issues. And for you, Stephanie, the partnerships, building those partnerships is very critical at the end of the day. It's all about not leaving anyone behind. So I'd like to, in time, state once again that Making Cities Resilient 2030 is a global partnership that has mobilized more than 1,460 local governments, representing more than 450 million people that have committed to strengthening their disaster and climate resilience efforts. And this webinar has been organized by MCR2030 Secretariat and the United Nations Office of Disaster Risk Reduction, and involving teams in Panama, Brussels, and Incheon. I have been your humble host, Martha Mugara from Kampala, Uganda, and it has been truly my pleasure to moderate this section. I thank you for attending, all of you, wherever you are, this morning, this afternoon, this evening, and I call it conclusion now, 2 minutes for our time, and request you to send in more comments. We shall be sharing this link with you of this deliberation so that we can carry forward the work that Carlos has so judiciously started for all of us. Thank you very much. It's my pleasure to call this webinar ending. Thank you. Bye-bye.